Raindrops fall from the sky. They may be small, but together they make a mighty ocean. In the same way, your commitment to doing good in the world enables the Rotary Foundation to fund the projects that you care about. Last year, even during a pandemic, hundreds of thousands of donors like you gave more than $440 million. Your generosity allowed the foundation to fund more than 2,000 global grants, creating opportunities for people everywhere to respond to their community's unique needs. A $15 donation could buy polio vaccines. A water filter cost only $50, and $100 could provide COVID-19 training. You supported causes such as fighting disease, building strong communities, and promoting lasting peace. So whether you gave $1 or $1 million, you gave help and hope. The people whose lives you've touched, the families, the parents, the children, thank you. And so do we.
Good morning. I'd like to welcome everybody to our webinar today, which is entitled Our Foundation, Our Future. I'm Roger Champion, Regional Rotary Foundation Coordinator for Rotary Zone 34. We'll have a polio update and an interview with our Rotary Foundation trustee, Aziz Memon from Pakistan. We will then hear a second interview and a story of service that has provided dramatic benefit to polio survivors in India. We feel that you'll truly be inspired by the good that these and other Rotarians are doing in the world. Let's start with a couple of housekeeping comments. If you would, look at your taskbar on the bottom of your screen and select your language in the taskbar. Please note this session is being recorded. You've been muted and we request that you stay on mute to ensure no background noise interferes with the presentation. Please make sure you speak of you for the best experience during the webinar. There'll be an opportunity for questions at the end of each presentation. Please note at the bottom of your screen, the chat bar and the Q&A bar. Use the chat box for general comments, but please put all questions for our speakers in the Q&A box only. That'll be extremely helpful and keep the Q&A period moving along smoothly. More than likely, we'll have more questions than we have time, so please understand as we try to get to as many questions as we can. Now I'd like to introduce Assistant Regional Rotary Foundation Coordinator, Ron Jansen. Ron will host a presentation and an interview with Rotary Foundation trustee, Aziz Memon.
Thank you, Roger. I have the privilege today of interviewing Rotary Foundation trustee, Aziz Memon. Aziz is the chair of the King's Group, one of the leading textile and ready-made garment manufacturing and exporting groups in Pakistan. He is also the chair of the Karachi Garment City, a project of the Pakistani government. A member of the Karachi Rotary Club since 1995, Aziz has widely been recognized for his leadership in polio eradication. He has served as a member of the International Polio Plus Committee and that committee's Pakistani chair. He is one of only 4 polio activists to receive the Louis Pasteur Medal from the Pasteur Institute. He has received the Service Above Self Award and the Citation for Meritorious Service. In 2012, the President of Pakistan conferred on him the Pride of Performance Award. His favorite Rotary project was working with this club to raise $285,000 to fund an English language instruction school for 4,000 students. He also led negotiations with the Taliban to gain safe passage for our health workers to administer vaccines in Afghanistan. He is currently taking the lead on a global grant for a treatment of wastewater and solid waste for hospitals in Pakistan. Aziz and his wife, Samina, are members of the Arch Clump Society. Welcome, Aziz.
Greetings, Rotarians and Rotary leaders of Zone 34. I am Aziz Memon, trustee of Rotary Foundation. My friends, we are going through a turbulent time. This is the bad time in the history of humanity with the global pandemic. It has taken 1.7 million lives so far, and we are fighting it. Rotary has jumped into it. Rotary has put in $46 million to fight this crisis. We hope that we will be successful. We hope that the scientists, the doctors of the world will be successful, and soon COVID will give us way to live our life normally and fight other diseases, including polio. While supporting COVID, we have not ignored other things. Rotary Foundation has been working, and this year we approved 467 district grants of $32.4 million, 30 disaster response grants of $0.7 million, and the global grants approved this year by 2,607 with a total funding of $143.6 million. This was the first year that the trustees of Rotary Foundation approved the first scale grant, which was of $2 million. My friends, the Rotarians of Zone 34, we had set a target of $410 million for the year which has ended. And with your support, with the support of Rotarians all over the world, we were able to reach $440.9 million. Thank you very much for your generosity. Out of that, we have this year spent $143 million on global grants. For the Polio Challenge Fund, we crossed $50 million and we got $100 million from Bill Melinda Gates Foundation. We are thankful to them, and we were able to spend $152.9 million for polio eradication. Polio is still a challenge. We need the donations. And as we run the last leg, we need every penny. We need every cent. We need whatever you can give us to keep us on the track, to keep us fighting, and to give you the good news. I'm sure that the Rotarians of your zone, who have always been very generous in supporting the funding program, will not be slow in responding to our request this time also. We have several fundraising programs, and you are aware of that. Rotary Foundation will be able to guide you and support you more on reaching our goal. These are some of the figures and numbers of the polio cases of 2014 to 2021. The red graph is of India, which shows that the numbers went down, came up, and again went down. The same applies to the position of Pakistan. Our numbers went down, climbed up, and again went down. And now the good news is that for last 8 months, there has not been a single wild polio case in Pakistan and Afghanistan. We hope that we can keep the same numbers and give you the good news soon. Advocacy we do from the level of the district council to the highest level of Prime Minister, Chief of Army Staff, the President of the country, all the ministers, all the chief ministers. These are two of the pictures which show the Rotary Foundation trustee chair and Rotary Foundation president having a meeting with Chief of Army Staff and the Prime Minister of Pakistan. My friends, we are doing our best and will continue to do. Rotary support to the challenge in polio eradication are many. I've just highlighted a few of them in front of you on these slides. The challenges are there, but the Rotarians are committed. The Rotarians are determined that they will fulfill the promise we made to the children of the world that no child will die of this crippling disease. In our program, we have got, besides advocacy, we have got several other parts, like we do the religious leaders workshop, in which we gather the ulmas and the religious leaders and talk to them about the suspicions they have in the mind. Along with Rotary, Coca-Cola Pakistan, and with the support of the global grants, and with the support of the Rotarians from across the world, we have been putting up water filtration plants. I would encourage your zone also to support us in this program, because clean drinking water is a necessity and many diseases are waterborne, including polio. So let's give clean drinking water to the poor, deprived people of Pakistan. Our, permanent transit posts, they are there on the Afghan border, Torkam border, Chaman border, and all the crossings we have permanent transit posts, Rotary permanent transit posts, where the volunteers go from one bus to another giving polio drops. Last year, an independent report said that the number of citizens who got the vaccine OPV at the permanent transit post set up by Rotary was 3 million. So you can see that how much difference it creates. Ulma workshops do a lot in converting the refusals, in getting to the not available, and doing everything possible. Our resource centers are also fully operative. From Bannu to Karachi, we have got resource centers in which we do all the activities required for polio eradication. In one NID, we target 40 million plus children across the whole of Pakistan. It's a big country. It's a big country from one end to the north, around 1600 kilometers. We have got porous border with Afghanistan of 2400 kilometers. So it's a big challenge. It's a big challenge that we need to vaccinate our children and at the same time keep an eye on the border migration with Afghanistan, which has been going on for centuries and will continue. So we have to keep an eye and vaccinate every child crossing over from Afghanistan, whether it is from Torkam border, whether it is from Chaman border, or whether it is from just, from Sand, they drive and they come at morning, in night, anytime, they just come. So we have to be aware of that. we need to be vigilant there, and we have to work with just not the federal government, but we need to work with all the provincial government, all the 4 provincial government. So Rotarians are there everywhere. We have got 2 districts, and our 2 governors are fully committed. Our Rotarians, which are more than 4,000, are fully committed to keep working to fulfill our promise of a polio-free world. My friends, before I would say goodbye to you, I would just share a small story. It was a few months back that I was visiting a health camp in Gadab. Now, Gadab is a slum area where most of the migrants, whether they come from Afghanistan or KP or Waziristan, live there. And they are deprived of road, water, hygiene, sanitation. So having a health camp there was really the need of the time. When I was moving from one point to another, I could see about 9 to 10 years old girl with a broken cell phone in her hand moving around just behind me. She was wearing rubber slippers also. At one point, I stopped by, called the girl and asked her that you need some help, you need some money for the fees, you need some treatment, you need some medicine, tell me what we can do for you. She smiled and she said, no, nothing, I don't need anything. I just like to be with you. I said, okay. We moved again. Then she, as I had spoken to her, she had the courage to come to me and she said that, can I have a selfie with you? I said, well, I have got no objection, but I'll need to sit down on the ground where the water is also there. So I did sit down. She took a picture. I said, what will you do with the picture? She said, I'll put it on the Facebook. I'm your follower. I said, okay, thank you very much. Go ahead, do that. Well, my round of the health camp continued. And when it came to an end, I again called the girl. I said, now you have to tell me that you are my follower on the Facebook. You took selfie with me. You want to go where I go. What is the reason? She replied, because you are doing a very good work and I pray for your safety, for your health, but you cannot help me. I said, why I cannot help you? She replied, with some tears in her eyes, that my small brother, 4 years old, is a polio survivor. I know you cannot do anything, but you can protect other children from this crippling disease. So I spread your message everywhere and I keep a track of your moments. I'm thankful to that girl and I realize our limitation, that there are times when we are helpless, when we are told that you did not come on time, you did not save my brother. Those are bad times. Those are sad times. Let us now move forward, complete our mission, and give the message that this world, thanks to Jonas Salk, thanks to Rotarians, is now polio free. Thank you for listening to me and have a good day. Thank you.
Thank you, Aziz, particularly for sharing that personal story about the young girl. It reminds us that even though our chapter in polio is closed and nearly forgotten here in North America, it's still very much a part of your life and your corner of the world, and reminds us we must continue to support Polio Plus. And thank you, Aziz, for all that you have done on the front lines of this battle to fight polio.
At this time, I was going to call on our two ARFC's Court Dowers and Rich Kirshner, and see if we have any questions in the Q&A box for Aziz.
Well, good morning. I see we have a couple of questions here. And the first question is, we understand that you have been doing some negotiations with the Taliban. Could you tell us more about that?
I would love to. As a matter of fact, I came to answer this question, and I'm sorry for coming a little late because I was at a Ulma workshop. Ulma workshop is the religious leaders workshop. Now, we have redoubled our efforts, and we try to engage the religious leaders, the social mobilizers as much as possible. The team lead of UNICEF also, Hamish Young, was with me, and we had a good gathering, good talk. So as we try to reach our goal, 9 months without a case is a good number. Months without a single environment sample being positive is something remarkable. Thanks to your generosity that we are moving forward. Now, your question will take me back to 2014-15. This was the time when the two parts of Pakistan, North and South Waziristan, were under the control of Taliban. For my friends who are in United States and other part of the world, Taliban are just not like, you would say Japanese or Koreans. No. Taliban is just a nomenclature to describe someone who believes in the religious thoughts. But then there are different groups of them. They are different, they follow different sermons, they lead different lives. Now, this time, what had happened was that after the incident of Osama bin Laden and after the several attacks of drones in that region and Afghanistan, that the Taliban had given a warning that no child would be allowed to be given OPV. As a result of that, just alone in North and South Waziristan, that year we reported 380 wild polio cases, 380. So it was quite bad, we tried our best, the government was trying, and then there was one religious leader, Maulana Samiul Haq. He has passed away. He was a good friend of mine. I knew he had good contacts with the Taliban. So I told him that I would like to come and have tea with you. He said, no, you come and have meal with me. I went and spent some time with him. And he said, tell me what I can do for you. I said, I want to have meeting with Taliban and only you and you can do that. He said, but are you going crazy? Why you want to take that risk? I said, it's not for me. I've lived my good life. It's for the children. Why not? And after all, they're human beings, let me go and talk to him. He said, it will be very, very risky, and your family may not permit. I said, my family will not come to know also. It will be just between you and me. He said, okay, give me 1 week. Let me find out if they would like to meet you or not. I said, good. So I waited for a week, and I got a call from his office that I should again go and see him. He said, again, I called you because he used to live in Peshawar. He's no more. He said, because I don't want to talk on this subject on telephone. So he said, they have searched your background and everything, and they've agreed to meet you on their conditions. I said, fine, I'll accept all conditions. So he said, you're sure? I said, I'm sure. He said, I'm sending you, but I'm not guaranteeing you they'll come back. I said, I'll come back because I'm going for a noble cause. So anyway, I left early in the morning. 2-3 cars were changed. And finally, in the last car I got in, they said that we'll have to blindfold you. I said, fine, I'm perfectly all right, relax. And we got there. We had a long, long session. It was only fruits coming again and again, and I had enough of it. So they said that we know why you have come. I said, then oblige me, please do it. I've not come to ask for anything for myself. I've come to ask for the children. They are your children, they are my children, they are your grandchildren, my grandchildren. So he said that you have come here to ask for this. You know the US officials, you know everyone. Why don't you stop the drone attacks? I said, see, that is a political thing. I did not start it. How can I stop it? And not even a political leader will be able to oblige you on that. He said, you can at least try. I said, see, my trying is one thing. I am a believer in peace, in harmony, in negotiation. That's why I took the risk of coming to you. Anyway, went on for 4 hours, 5 hours. And I said, at least give a break. Build up some good negotiation atmosphere. Give a pause and let the children be vaccinated. They are being crippled. If 380 children are crippled in North and South Waziristan, they are not my relatives. We don't live there. Your families live there. So whom have you hurt? Think about it. Now, this gave them a thought. They discussed in their language slowly and gradually, and then said that, okay, we will consider you request. Yeah, we will consider your request, provided you will give us a pledge that whenever there is an opportunity within you or close to you, you will try to stop the drone attacks. I said, see, I have told you that I'm not for drone attacks. And I cannot promise you, but when you're saying that I should do my best, I will do my best. Whenever it comes to me, I will do it, and I promise you I'll do it. But let the children be vaccinated. Let the children be given OPV. There is nothing against the religion. That is nothing against the health. And just for the sake of, simple things that political things, you want to victimize your own children, no one else. So anyway, then it was getting dark also, and I had to be dispatched out before it was absolutely dark. So they said, you will have meal and go. I said, no, I had enough of fruit. They said, fine, we are going to have our majlis, means our meeting, in a day or two, and we will consider your request and we will try to our best, and our decision will be conveyed to you. In 2 days, they did convey the decision that they would allow the children to have OPV. So I thought that my taking risk, and if my life was at risk, I did gain something. I gained a promise for the children. And now we are on our way towards eradicating polio. Thanks to your generosity. And while we run the last leg, please do not stop giving. Thank you very much.
Thank you, Aziz. We appreciate that answer that you gave to our question there. At this time, I'm going to turn the webinar back over to Ron Jansen for some additional comments. Ron?
Aziz has done so much for us to help in the battle to eradicate polio and continues to do so. Obviously, he's got a grant that I'd like him to just very briefly tell us about. We're limited on time, Aziz, but I know we've got some people that have already stepped forward some money, and we'd like to get a lot more today. Can you quick tell us something about?
Sure, I will tell you. As a matter of fact, I want to thank my friend Nancy also. This grant is of $240 US. This is just a machinery alone. And this grant is for treating hospital waste management. This is the techniques of hospital waste management treatment. And, you know, healthcare or medical waste comprising blood, body fluids, and other potentially infectious material is of 4 types. 1, infectious, 2, hazardous, 3, radioactive, and 4, general waste, which is 85% of total hospital waste. Daily unit per medical waste amounts per hospital per bed have increased from 0.43 kg per bed per day in 2000 to 1.68 kg per bed per day in the year 2017. Because so many new medications have come up, so many more radioactive medicines have come up. So every year, an estimated 16 billion injections are administered. 16 billion. Just imagine, now this I'm giving worldwide numbers, but not all the syringes and needles are disposed properly. Open burning, landfills, and in creation of healthcare waste can result in emission of dioxins, furans, and particulate matter. You know, so many methods have been used to dispose of this waste, but then those are not the green methods. And alteration to incineration such as autoclaving and microwaving, steam treatment integrated with internal mixing with minimized formation and release of chemicals or hazard emission was also considered. Now, an Italian company called Neuster, I will be too glad to share the brochure. Neuster has come up with a new technique, a new management equipment. I have got some pictures also of that, was found as the green alternative to the increation. It uses a thermal friction to sterilize clinical and sharp basty material. It inerts an unrecognizable form. Sterilizing chamber has high-speed rotating stainless steel blades to grind the waste by friction under very high temperature, resulting into dry, odorless, inert, sterile granules. So this is something, a wonderful machine. And, you know, when we try to save lives, we at the same time, by using so many radioactive and other materials, we jeopardize the nature also. So this protects the nature. Now for this grant, my home club, Rotary Club Karachi, has put in $110,000. We have got some money from Japan, some from Korea, some from USA. and some from Canada, and some from Nancy Barbie. And so, you know, we need $25,000 to submit this grant. So if DDF, so if you can raise this money, you would be doing a noble cause. You will be helping a noble cause. You would be protecting the environment at the same time, helping us in getting rid of the waste. Thank you. If there are any questions, I'll be too glad to answer.
Aziz, thank you very much for that information. We are running very short on time, but Aziz has done so much for us in the fighting polio. Let's give some support to Aziz. And I see one district has already added $1,000. Nancy's put in $10,000. Let's see what we can do to get this funded, because it's really critical to eradicating polio. Again, thank you so much, Aziz.
Thank you. Thank you. Bye-bye. Bye-bye. And we'll be in touch with you. Thank you. Thank you, Roger. Thank you, Ron. Thank you. I can see some directors also. Thank you very much for listening to me. Thank you. Thank you.
Thank you, Aziz. Thank you, Ron. I'd like to now introduce Kim Waters, who's our In Polio Now coordinator for the state of Georgia in Zone 34, and she will host our second interview. Kim?
Thanks. I'm pleased to introduce our next speaker. A member of the E-Club Belgaum, Narasinha Joshi, is an In Polio Now Fellow and major donor of the Rotary Foundation. He is passionate about helping others through global grants, like the project to provide corrective surgeries for polio survivors that he will discuss today. Welcome, Joshi.
Thank you.
How and when, Joshi, did this grant start?
Our club was started in 2012, and we were, inducting the new members. So we got a doctor who became a member of our club, and he was very passionate and ready to serve to those polio survivors through his service. He is an orthopedic surgeon, Dr. Anil Patil. So he suggested, why don't we take up this corrective surgery for these polio affected beneficiaries. So you can see in the screen, the person named Mr. Kumar. His age that time was 11 years old, and he was totally stationary, and he was dependent on the parents for any movable. It is absolutely immovable person he was. And Dr. Anil Patil saw this boy, and he did the operation at free of cost and with the help of NGO and other donors. After seeing his success, he started walking with a walker and using the wheelchair. So his poor parents are so happy that this boy has started moving on his own. So this boy has motivated to do this project.
Can you speak about and share the impact of these stories?
Yeah. Next slide, please. Next slide, please. Okay. So after operation of this, we started doing this so many camps, free camps, in the nearby villages, in the cities, and we visited the Handicap Association, Civil Hospital. We started screening all the needy people who are eligible for this operation. So Dr. Anil Patil, along with his staff, we conducted various camps, and we could shortlist around 50 beneficiaries, and their further screening of those cases have started. Next slide, please. This is the one case. You can see a boy whose name is Mr. Giri. He's a 20-year-old boy. You can see his both ankles are totally twisted, and he was not able to go for the job, or he was not getting the job because of his this problem. And Anil Patil took this case as a challenge and operated him, and saw that his both the ankles straightened. And now I'm happy to share with you all, he's driving the two-wheeler and is attending his job. His parents are very happy, and he is feeling so happy that he is now self-employed with the help of this operation. And he is always in connect with us. And during our international partners visit in Belgaum, he visited in that two-wheeler only. Next slide, please. You can see three ladies here. They are very unique. The first one, Miss Manisha Patil. She was not able to walk with the walker, or she was on the wheelchair for so many years because of the polio virus and affected. After the operation, I am very happy to share with you all, she took a part in the Para-Olympic and attended Thailand in the game chair was basketball, and they came in third place. And you just imagine the happiness on their family and for her, and it's unbelievable. You can only sense the happiness from her, because it is a remarkable achievement from a girl going abroad and playing for the country. And second one was a beautician. Because of her handicap and polio, she was not able to attend door to door, or you can say marriage hall, from one marriage hall to another marriage hall, to do the beautician of the bride. After the operation, she started moving in the vehicle, that is obviously a handicapped, specially abled vehicle, and so she can attend so many functions, and she's carrying her beautician, and she's expert in henna, that is a skin design, drawing that we do it in a marriage for the girl, and she's earning very nicely. And this story, she has become very famous in our part, that is she's staying in our city only. So Kumar, Giri and Manish, these three cases. And can I please show the videos? This is the Mr. Giri before the operation. It is very difficult to walk, and you can see his both the ankles. Can you show this after operation video, please? Yeah. You can see his both the legs are now straightened, and he can walk without the footwear also. Next, please. This is after operation. Next video, please. This is also operation. After operation, she was sitting in one place for on a wheelchair, which she is not able to walk with the walker. And after the operation, and she is independently walk with the help of the walker. She can do the routine on her own. Her name is Dhanashri. Next video, please. thank you, Sin, for sharing all these videos. Kim, any questions?
Thank you for sharing all of the impacts. We appreciate you sharing this project, its impact. Do you have any final comments? Let me see if we have any questions here for you.
Yeah, definitely. I would like to thank for inviting me and sharing these success stories. And I am grateful to the Rotary Foundation and particularly the international partners. And I'm very happy to say 6960 PDG Sandra is our partner. And we since 2016, we are friends along with the Australia district and the New Zealand district. And what I would really appreciate is the help of the friends, the connectivity, and the donors, and help from your zone has really made these 34 beneficiaries a life-changing experience and absolutely unbelievable experience when you can see these people's face and their attitude, their parents' response. You'll realize the importance and the worth of our donations, what we have done to the TRF. I'm really thankful to the TRF and all our partners and continuous support from the Sandra and all other our partners, and particularly great thanks to our Rotarian Dr. Anil Patil. He is not charging a single dollar for any surgery till date. So we are spending only for the hospitalization and medicines. And the grant is still going on. We are hopefully by this year end or coming year, we can close the grant. Because of this pandemic, we could not take up the cases. So once again, I thank you all for inviting me and sharing my a little experience, and I'm very happy. And thank you once again.
Thank you, Joshi, for sharing. So nice to see you again. Thank you.
Thank you, Josie and Kim, for the great interview and for the story. Next, I'd like to introduce the other two End Polio Now coordinators for Zone 34. Lindsay Casino is the coordinator for the Caribbean, and Nick Hall is the coordinator for the state of Florida. Today, Nick and Lindsay will give the summary remarks for our webinar today, and I'll turn the meeting over first to Lindsay and then to Nick. Then Nick will follow after Lindsay finishes. Lindsay?
Thank you, Roger. So we have the task of summarizing what you've heard today, and I'll start with a short slide presentation. We've got lots of positives to talk about in our 36+ year fight against polio. Over 3 billion children have now received the polio vaccine. 19 million people are not paralyzed who would otherwise be as a result of this campaign. And we've gone more than 4 years now without a case other than Pakistan and Afghanistan, having eradicated polio from the continent of Africa recently as well and been certified. Polio Plus has also helped with other vaccine preventable diseases, for example, measles, and the unintended benefit, the infrastructure that we've created in these last 36 years and the resources that we have as a result of it have helped tremendously with the response to assisting with outbreaks in Ebola and, of course, our ever-present friend in recent years, COVID-19. Next slide, please. So here we have the timeline for the newly launched GPEI strategy to finish the job of eradicating polio once and for all. While the new strategy formally begins in 2022, many activities will get underway immediately. In quarters 3 and 4 of calendar 21, there will be broader use of the new novel oral polio vaccine to more effectively stop outbreaks of circulating vaccine-derived poliovirus type 2. Interruption of wild poliovirus type 1, the only wild type of poliovirus still circulating, and reporting the last isolate of circulating vaccine-derived poliovirus is planned for the end of 2023, which would be a momentous occasion. And the certification of the eradication of type 1 polio virus and the validation of the absence of circulating vaccine-derived polio virus is planned for the end of 2026. In other words, that will be the cause for great celebration because we will be done. Next slide. We can feel good that the number of wild polio and circulating vaccine-derived polio cases continues to decline, but now is not the time to be complacent. Rather, we need to capitalize on this progress to maintain high levels of immunity among children such that we can achieve eradication. This requires hundreds of thousands of frontline workers immunizing hundreds of millions of children and intensifying disease surveillance activities to be sure we know where the virus may be circulating. A robust surveillance system is also essential to proving that we have interrupted transmission of the polio virus. Next slide. Early cost modeling suggests the budget for the new plan will be around US $5 billion. But again, this is an early modeling that now requires in-depth budget development and has just been presented for approval in September of this year. So we should treat this as an early estimate, noting that every effort will be made to reduce cost and ensure the budget reflects funding requirements for the activities that are on the critical path to eradication. The main cost drivers of the new strategy are surveillance to detect polio in children, and the environment, immunization campaigns, collaborating with other programs and activities to reach those children we continue to miss with polio vaccines. Vaccine supply, obviously also an issue to fully implement the new plan, and staffing to carry out the strategies identified in the plan. Next slide. So that is why we have this annual goal of reaching 50 million within Rotary for polio eradication. And the 50 million is a magic number because, as you heard, when we get to 50 million, we get a match, a 2-for-1 match from the Bill and Melinda Gates Foundation of 100 million. So that 50 million becomes 150 and basically funds Rotary's contribution annually to the fight. And as you can see, we've done commendably well, but there is room for improvement in all areas of coverage within our districts around the world. Next slide. So helping us continue to reach this 50 million goal next year, we need to ensure, and that's why we need your help as DRFCs, we need to ensure that every district and club has a Polio Plus chair and a goal, a fundraising goal to eradicate polio. We want to increase the number of districts and clubs giving by hopefully 10% or more, secure at least one major gift per district that is matched and leveraged by the Gates offer. So in other words, every $10,000 major gift we get becomes $30,000. You can see how important that is. We also need to make better use of social media for securing additional funding, and involve the community in what we do. We just celebrated World Polio Day last week, and World Immunization Week is coming up in April of 22, or as it does every year. These are important milestones to use in fundraising for the eradication of polio. Consider some new ideas. One that has been very popular and very well taken up, I should say, particularly in Zone 34 and 33, is this new idea of the Polio Plus Society. The limits, it is run by the district, not RI or the Rotary Foundation, so you have to take on that responsibility. But it has shown great progress with helping to not only get more money, but to sustainably continue those donations as we progress to eradication. Next slide. So before I hand over to my Florida EPNC colleague, Nick Hall, let's quickly review the recent occurrence of both wild and vaccine-derived cases in the world. As you can see on the left, we suffered a surge in wild polio in 2019 and 2020 in particular. Lack of access to vaccinate children was the main culprit in 2019 for a variety of reasons, but continuing in 2020 largely due to the COVID-19 pandemic outbreak and lockdown. However, only 2 new cases have been recorded in 2021, and this demonstrates the huge progress we have made since relaunching mass vaccination campaigns in the summer of 2020. Vaccine-derived cases surged starting in 2017 and 18, but particularly in 2019 and then dramatically in 2020. Due to the transition in 2016 from a trivalent vaccine to the original bivalent OPV, oral polio vaccine, which had the unintended effect of creating a surge in type 2 vaccine-derived infections. The introduction of the novel bivalent OPV type 2 earlier this year is showing huge positive results, as you can see, from the dramatic drop in cases in 2021. And now I'll turn it over to my friend Nick to close.
As Lindsay has just reminded us, the end of polio is within reach, a message that we've been hearing excitedly in recent months. However, we will reach the goal only if we remain vigilant and don't let our guard down. As indicated in the last image that Lindsay showed, prior to 2019, there had been a steady decline in the number of polio cases, leading to a great deal of optimism that the end was just around the corner. But then, as noted on the image, there was a significant increase in the number of wild and vaccine-derived polio cases in Pakistan and in Afghanistan. And that unexpected rise occurred in large part because of a switch from the tri to the bivalent vaccine, as noted by Lindsay. But I would point out that during the same time frame, there was a lot of misinformation about all vaccines, including polio. There were exaggerated news reports of polio vaccines, and this may also have been a factor. For example, early in 2019, which is when the increase began, some children experienced minor side effects after receiving the vaccine, the polio vaccine. None was serious enough to require hospitalization. However, in response to exaggerated television reports, along with Facebook and Twitter posts, some 2 million Pakistani households refused immunization for their children in the spring of 2019. Furthermore, traders and small retailers threatened to boycott a scheduled round of vaccinations if officials didn't withdraw plans for a new tax. According to a report in the Los Angeles Times, which included an interview with Aziz, published on the 5th of September in 2019, and I quote, "Pakistani health officials have been baffled by the idea that parents would risk exposing their children to the virus in order to make a political statement. It's a joke," said frustrated Aziz Memon, national chairman of the Polio Plus program in Pakistan, led by the charity Rotary International. "But these are just blackmailing tactics," he said. "The government is taking care of this in a serious way." He pointed out that the government has replaced anti-polio officials in poor-performing districts and redoubled efforts to win over tribal and religious leaders, some of whom have denounced polio vaccines as a Western plot to sterilize Muslims. That's the end of the Los Angeles Times quote, and also the end of my presentation.
Thank you, Nick.
The stopping point, and the reason is because I have been advised not to discuss the impact that similar misinformation regarding vaccines may have on the polio campaign in the United States as well as elsewhere in the world. And I don't want to make this a political discussion, so I'm going to just skip that whole section of my presentation. I'm going to wrap up instead by ending on a very positive note by reminding you that Lindsay's summary of the very inspiring news that we have labored long and hard to hear, with just 2 cases of polio since January, the end of polio is indeed in sight. But again, only if we remain vigilant and we address all the issues capable of impacting the End Polio Now effort, including those that might ruffle a few political feathers. So, thank you.
Thank you, Nick. Thank you, Lindsay, for the summary comments on Rotary's polio eradication efforts. We're going to now make a special presentation today, and I'd like to turn the webinar over to Laura Quintrell-Thomas. Laura is Assistant Regional Rotary Foundation Coordinator for Zone 34. Laura?
Thank you very much, Roger. Good afternoon, my Rotary friends and family. It's my privilege to introduce some very special individuals to you this afternoon. Firstly, past District Governor Jeremy Hurst, who will be our Zone RI Director in the next Rotary year. Hailing from the Cayman Islands, Jeremy is passionate about many Rotary projects, but really devoted to his work in Haiti, and in particular, the Haiti National Clean Water, Sanitation and Health Strategy. Our second special guest is Dr. Roshan Parasram, who is the Chief Medical Officer here in Trinidad and Tobago. Since the onset of the COVID-19 pandemic, Dr. Parasram has overseen the national response with regular comprehensive updates, calm and professional advice, and encouragement to our citizens. He has been front and center of our national COVID vaccination program, and I believe it is no exaggeration to say that he is now the person that the citizens of Trinidad and Tobago regard as their most reliable and trustworthy medical professional. I'm delighted to ask Director Jeremy to present this special award from Rotary to you this afternoon, Dr. Parasram.
Thank you so much, Lara, as well as Roger and your team for an excellent webinar today. On behalf of the Rotary Club of Central Port of Spain and all gathered here today with us, we're honored to present Dr. Parasram with one of Rotary's highest honors, a Paul Harris Fellow, in recognition of his tireless work during the COVID-19 pandemic. Paul Harris founded Rotary more than 100 years ago, and this award pays tribute to his vision of a world of fellowship and service, and contributes to our Rotary Foundation's continued work in polio eradication, protecting the environment, peace and conflict resolution, water and sanitation, economic and community development, maternal and child health care, and of course, the reason for this award, disease prevention and treatment. Recipients of the PHF, as we call it, include Mother Teresa, US President Jimmy Carter, and Jonas Salk, the very creator of the polio vaccine. So Dr. Parasram, you're in great company. Rotarians believe in vaccination. Our global efforts to eradicate polio are almost at an end, as the last 2 countries in the world count down to being declared polio-free, as you heard earlier. But this was not done by Rotarians alone. Our partnerships with the World Health Organization, Bill and Melinda Gates Foundation, governments and countless volunteers and health professionals enabled us to vaccinate more than 2.5 billion children since the program began in 1979. Dr. Parasram, we know that you understand the importance of these types of partnerships and collaborations, as Rotary clubs across the world, including in the Caribbean, supported COVID-19 vaccination rollouts. The certificate that the Rotary Club will deliver to your office, along with the Paul Harris pin, are symbols of our appreciation for those who continue to do good in the world. Dr. Parasram, we're honored to have you with us today, grateful for your exceptionally hard work in the medical field, and delighted to present you virtually with this most important Rotary recognition. Please wear your PHF pin once you receive it proudly. Thank you once again.
Thank you very much.
Thank you, Dr. Parasram and Jeremy. Yes, would you like to say a few words?
I mean, it is indeed a polio workshop. So just to add the voice as the CMO of Trinidad and Tobago, and first of all, to say thank you very much from the bottom of my heart, and really for the people of Trinidad and Tobago for the award. It was very unexpected, and I'm humbled and honored to receive such a great award, and continue to be in awe at the work of all Rotarians, giving selflessly of their time and service to the people of the world, trying to bring polio to an end and many other diseases. In Trinidad, our story, as you know, we haven't had a case. We've been very fortunate in having a population that has received the vaccination very well from the start. We haven't had a confirmed case since 1972. In 2019, we would have had a vaccination rate in that group of over 100%, 103%, which meant we catered for some of our migrant populations. We saw it slipping a little bit, and that last presenter really hit home a bit with the misinformation in the public domain with vaccination. I think it has not only affected COVID-19 vaccination, but all vaccination programs across the board. And we have to be a little cognizant of the fact that we have to pay a little more attention to our existing campaigns, focus and get to those individuals that really need it most, and try to get our rates back up. But really saluting all the Rotarians across the world, and especially in Trinidad and Tobago. We have a long history of collaboration and camaraderie with the Rotary clubs in all the regions at the ministry. And really thank you again, once again, for this award. I'm grateful and humble to be chosen as the recipient.
Thank you very much, Dr. Parasram. And our Rotary Club will arrange to deliver the certificate and the pin to your office, of course, complying with all COVID protocols. And thank you, Jeremy, for your kind words and your support of this presentation. Thank you for your tireless dedication to the health and well-being of the citizens of Trinidad and Tobago, Dr. Parasram. Back to you, Roger.
Thank you, Laura. I'd like to thank everybody for attending the webinar today. I hope you enjoyed the presentations and you were inspired by the great works that Rotary does. Please encourage your fellow Rotarians to support the continued funding of our global grants through contributions to the Rotary Foundation Annual Fund, and to our continued fight against polio by contributions to the Polio Plus Fund. Just a reminder, the webinar is being recorded and will be available for sharing with others that may not have been able to attend. And with that, I thank you again and good day.